Older adults comprise a small fraction of our population in the United States, yet they account for a large percentage of hospital stays. Almost half of hospitalized older adults will experience a loss of physical function related to their hospitalization, and many have complex medical regimens that complicate their home recovery. Without adequate support, older adults experience difficult home transitions that lead to dissatisfaction in care and potential readmissions. Consequently, caregivers worry about their ability to provide the needed care at home. The DEFT Center is the Duke Elder Family and Caregiver Training Center. It's a collaboration between the Duke University School of Nursing and the Duke University Health System, designed to give assistance to caregivers during challenging care transitions. Christina Hendricks is the center's director.
I think there's a clear need for caregiver support and training. My program of research here at the Duke University School of Nursing focused on caregiver education. And in the several trials that I have conducted, I found out that the caregivers are really thirsty for knowledge and some sort of a one-to-one training on the skills that they will need once they are at home with their loved ones. I also found out that they are receptive to training. So when an opportunity came that we can have some funding to launch the DEFT Center, we wrote the proposal, and with the support from Dean Broom, we were very fortunate to receive funding from the Duke Endowment.
The DEFT Center at Duke provides training to caregivers of elder patients who have complex medical regimens and prescriptions. Dr. Richard Riddell says this is a serious challenge for patients.
I would say that for any patient that's admitted to our inpatient ward, they're dealing with a number of significant challenges. Our patients are admitted for a wide range of problems that can be related to their disease or to their related treatment. And while they often will make significant advances in the hospital, one of the challenges in critical time periods is in that time period when they leave the hospital. Oftentimes they will have a series of new medications that they need to take. Many of our patients will have a medical apparatus, for example, that's been placed that needs to be cared for. And so while our patients are making that adjustment from the inpatient ward to closer to home, those challenges can be burdensome for both patients and caregivers.
Judy Pruitt is on the leadership team and said the DEFT Center has great potential to improve patient care.
Having that ability to partner with everyone within our health system and the Duke School of Nursing, which is a huge resource of just knowledge and forward thinking, it makes it so much better for our patients. When you start thinking about what we can accomplish as a team, it becomes so much easier to think about making those huge leaps in our care transitions and our care for our patients when you have that strong partner like Dr. Hendricks, to be able to think forward and think beyond the boundaries of what we think of. Sometimes we get stuck in what we can't do, and the thing I really appreciate about the DEFT program, and Dr. Hendricks in particular, is she thinks, what can't we do? Is we can make this a huge opportunity. And so I really like that ability to reach forward, to push beyond what we've always thought we can do. And to me, that's the most exciting thing.
The DEFT Center team is working to develop, implement, and evaluate an innovative and scalable model for teaching, training, and supporting caregivers who assist and care for elders at home following a hospital or rehabilitation discharge.
Unlike the other transitional care programs that we have in the country, I think what makes DEFT innovative is that we are synergizing the strengths of the different components of a university health system. So this will be the medical and the academic components. In the academic side, we are utilizing our graduate nursing students to provide caregiver training to just family caregivers. I think it's a win-win approach not only for our students but for the family caregivers as well. We also increase our capacity to touch more caregivers, by involving our students. Not only do we prepare them in the right way, not taking care of patients and caregivers, but we also sensitize them to the difficulties that family caregivers face during the hospital-to-home discharge.
By preparing and empowering individuals in their roles as caregivers of homebound older adults, especially during challenging transitions, the DEFT Center will provide something we can all use: more successful outcomes for older Americans returning from hospital stays. To read more about the DEFT Center, visit our website, nursing.duke.edu/DEFT.